Hi there, my name is Dr. Mashhood and I'm an emergency medicine consultant. Being an emergency medicine consultant, I have gained experience in working in different parts of the world. I have worked in various hospitals all over the UK, as well as Pakistan and different parts of the Gulf countries. I'm going to talk about what is emergency medicine and why emergency medicine is so important. Emergency medicine is a new specialty which has not been long that it's been developed in the US, UK and the rest of the world. And in certain countries such as Southeast Asia, it is still developing into a specialized specialty. Emergency medicine is normally said that it is 60 minutes of first 60 minutes of every other specialty, which means that it is so important that it involves all the branches of medicine as well as surgery. It is also called the golden hour of patient care. So emergency medicine, you can say, is the most important time a critically unwell patient will have in their life. The importance of emergency medicine is it takes undifferentiated patients. That means patients having all different types of diseases and presentations can come to emergency medicine departments, and the emergency medicine physicians will be able to deal with them. This provides a unique opportunity to the emergency medicine physicians to have wide breadth of knowledge so they can deal with all the different specialty presentations. The other important thing which I like about emergency medicine is that it involves a lot of procedures and hands-on work. For example, procedures such as intubations, central line insertion, arterial line insertion, chest tube insertion, urinary catheter insertion, fractures, dislocation and manipulations and relocation of those fractures are all important procedures which all emergency medicine physicians should be used to and really expert on. This is a unique quality of emergency medicine physician which no other specialty can provide. Now, the other biggest advantage of being an emergency medicine physician is that you get used to working in very stressful and demanding situations. It's a well-known fact that emergency departments all around the world are busy, but then again, it allows the physician to develop a certain skill set to remain calm in very stressful situations. The other advantage is that emergency medicine physicians have a well-rounded personalities. That means they are able to do very good communications, not just with their patients, relatives, but also different doctors from different specialties, because they are involved in providing care. Now, there are some certain drawbacks which with everything there are pros and cons. One of the biggest drawbacks of emergency medicine physician is working a shift pattern mostly over the weekends, antisocial hours, which other specialty might not do it. But I think this is a very small side effect as opposed to the biggest advantages we have being emergency medicine physicians. Now, why is this important? In developed countries such as UK, US, Canada, North America, and most of the Europe, emergency medicine is very well developed. Because the emergency medicine is very well developed, the mortality rate or death rates is much lower than developing countries where emergency medicine still needs a lot of work to get developed. The old school methodology in most of the casualty emergency medicine departments in developing countries is that people or physicians from other specialties come and work within the emergency department. So they're not being provided the emergency medicine training, but they are trained in their own specialty and they come and do part-time work in the emergency department. What the developed countries are doing and what countries where emergency medicine is well developed have done, they have developed their own residency or specialty programs in which the physicians who get enrolled into those residency or specialty programs just get emergency medicine training. As part of the emergency medicine training, they are also exposed, or they get exposure in different parts or different specialties such as critical care, medicine, surgery, etc., depending on the residency program. The importance of emergency medicine can never be underestimated. We can clearly see why this is an emerging specialty, and in future it will carry even more importance. The other biggest advantage of being an emergency medicine physician is you can subspecialize into different areas. For example, you can do critical care specialization as part of your emergency medicine program. You can do fellowship in critical care. You can do ultrasound fellowship, so that will allow you to get involved in different teaching and research projects based on ultrasound. You can also branch out into medical education as part of emergency medicine. Toxicology is a very important field of emergency medicine where you can subspecialize in toxicology. In summary, there's a lot of broad bit of things you can do within emergency medicine. Emergency medicine is a lovely field, it's an exciting field. It's for people who really want to do the best for the patients, who can work in stressful environments and they remain calm most of the times. If you have any comments and questions regarding emergency medicine, please mention them below and I will answer them accordingly. Thank you very much.